Hi everyone, I'm Dr. Karam. I'm a board certified facial plastic surgeon and I specialize in facial rejuvenation. And today I'm going to talk about a very, very important topic. That is, how do you, as a potential patient, choose the right surgeon for you for your facelift? Facelifts are a very common procedure because aging is an incredibly common thing, right? I mean, it happens to all of us. We eventually get to a point where our jawline and our neck and our mid-face and all that starts to sag, and as a result of that, we want to find a remedy, a solution for it. But at the same time, we have all seen so many unfortunate outcomes that leave a person looking like they've been windswept, or they have, they're going through a tunnel, or they suddenly look like a completely different person, and immediately we know that that person has had a facelift. The fact of the matter is, the facelift procedure, it is a unique operation that ultimately requires a specialist. You need to find a surgeon who specializes in those procedures, because the reality is there's a lot of different procedures that we can perform. A lot of plastic surgeons choose to focus almost exclusively on breast and body work, some on reconstruction work, some on rhinoplasty, and then some of us, like myself, have chosen to specialize in facial rejuvenation, which is the procedures that make somebody look younger, and at the foundation of that is the facelift procedure. So how do you know that is the type of surgeon that you're looking at? So number one, I would say, look at their before and afters. If you see tons and tons of repetitive images of facelift procedures being performed and quality, beautiful, natural looking outcomes, that right there is a huge testimonial that you can research on your own to figure out that yes, this particular surgeon I'm interested in, really makes this his focus of his practice, or she makes the focus of their practice. And as a result, that's a great starting point, understanding that this individual specializes. So specialization is very important. The second aspect of it is visually, what you're looking for is, when you look at the before photo and you look at the after photo, what you're looking to see is, does this individual look like the same person, just minus the aging? So that retention of self-image and self-identity is very important to many of us, I would say to all of us. And I've never met a patient who's ever said, I'm willing to look like a different person minus my jawline and neck sagging. They all just want to look like themselves. Examine before and afters for consistency, for natural looking results, etc. Those are really important parts to this. The next thing I would say personally, and I can say this only because I've had my own evolution of surgical techniques that I performed over the years. There's a lot of techniques out there. I certainly don't want to say one is better than the other, and we all have our preferences. All of us perform procedures differently from one another. I don't think there's any cookie cutting going on here, because we all have our sensibilities and our preferences, etc. But I will say that there is one common feature to a really natural looking result, and in my opinion, and that is the vertical nature of the procedure. Now, we're not talking about straight vertical, but we're just saying vertically oriented. So think of it as when you put your finger right here on your cheekbone and your thumb here on your jawline. This is what most people end up doing in the mirror. They kind of go up and down like this. They're going upward towards this direction. And that, to me, is a vertically oriented vector, where in contrast, most of the facelifts that have been performed, or described, I should say, and most of us who've been trained by others to how to do them, it's more or less a horizontal, it's a sideways motion. When you open up our plastic surgery textbooks, you see most of the descriptions of a face going side to side. And that's not what an individual asks for when they sit in front of you. They're going vertically. They're like, this is what I want. I want my jawline and neck to be corrected. I want to go this way. And as a surgeon, it's our obligation to create that result. But in order to do that, we have to do it in a vertically oriented way. So vertically oriented procedures, in my opinion, are much more natural looking and much more effective, if you will. So creating a vertically oriented lift is really important. And that's a conversation you can have directly with your surgeon, but also you can see that in the before and afters, because they're going to look a lot more natural. The other aspect of it is, within that same space, is the type of technique. I have gone from a technique where I was shortening the fascia, the SMAS that has elongated, and repositioning it vertically. Later on, about 10, 12 years after examining my results over the years, I decided to transition to what I now call the vertical restore, which is basically a combination of a deep plane, vertically oriented deep plane lift with a lateral brow lift, with a jawline, with a neck lift included. So it's basically 4 procedures together where we take care of the lateral brow, mid-face, jawline, and neck. And from my perspective and my recommendation for you, you need to address all of it at one time, because when this comes down, it causes this to come down, causes this to come down, this come down, your neck come down. So if you're only addressing, say, the jawline and not addressing the neck, or not addressing the upper face, and if you're truly going vertically, you're going to get some pleating right in this area, and it's going to look funny. But more importantly, you're not going to get a complete repositioning of all that loose fascia. So that's, I think, one of the best parts about the vertical restore is its completion in combination with its verticality. Now, I really do believe that the deep plane method is it's a very, very strong advance in the field of facial rejuvenation. It's not new. It's been around since the 1980s, and it still remains something that very few surgeons do, because it is technically more challenging to perform. But when you do perform it, and you do perform it well, the results look really nice. They're very natural looking, and the best sort of bonus of all that is the deep plane lasts a lot longer than your typical lift. So as long as it's combined with your neck and combined with something up top, you can create a very beautiful outcome. And those are sort of the major caveats that I would say you want to seek. Now, other aspects which have nothing to do with outcome, but are, sort of bonuses, I would say. I mean, if you can get this done under local with IV sedation, that's a bonus. It really helps decrease the potential for complications that can happen as a result of surgery, etc. Recovery is a little bit easier, and you're going to go along. So, in summary, look for a surgeon who's a specialist, who's doing this regularly every single week. You want to make sure that the before and afters meet the eye test. You look at them and you're like, okay, yeah, that's what I want for myself. And then, making sure that the technique is a proper technique, because the last thing you want is to look good for like a year or two and then all of a sudden come back and feel like everything has come down. So durability in technique is an important part of it, and that's where the deep plane comes into place. Finally, I would just say best recommendation: if you don't find somebody in your neighborhood, in your community, and within short driving distance, etc., do not hesitate to look outside of your area, because honestly, it's your face, and your face certainly requires that level of commitment to it. And when something goes wrong with it, or you don't like the outcome, correcting it is much more difficult, it's much more costly, etc. So making a short trip out of it, flying across the country, or wherever else you need to drive to or get to find the right surgeon for you is certainly worth it, in my opinion. And we have patients that literally travel from outside the US. I think it's really smart for somebody to invest like that for themselves. And that's obviously going to take some research, and it's going to take some commitment to find the surgeon that feels right to you. Final point is, I would say, from a financial point of view, if you have 2 equivalent surgeons and one of them happens to be less expensive than the other, and you feel just as good about the less expensive one, then go for it. If not, don't cut corners and try to save financially by letting money become the number one factor, because quite honestly, we see this all the time. Patients do that and make poor decision, and then they end up in a position where they have to spend literally 2 or 3 times as much to correct some problem. Wait a year or 2 or 3, whatever it takes to get to that point, because certainly these are non-emergency procedures, right? At the end of the day, they're very elective, but they can have huge emotional impacts in a positive way if it gets done correctly, and they can have major emotional they pull you down emotionally and can affect you if they're not done the right way, and if you end up having to redo it. So certainly take that advice to heart. Let everything else check out, and then let the financial aspect be your last piece of differentiation between surgeons. Anyway, that's probably the best advice I can give all of you who I know are going to have to look into this topic, or maybe actively looking into it, and this may be some guiding light in terms of how to proceed. Anyhow, anyhow, again, Dr. Amir Karam, I love sharing this type of information with you, try to make this journey as easy as possible. If you haven't already, subscribe to this channel so you can get more content like this. We talk about all things facial rejuvenation and skin rejuvenation, etc. Try to make the whole rejuvenation universe as simple and understandable as possible. So hit subscribe, share it with some friends, and if you like it, hit like, and if you have any questions or just want to tell me anything about this video, drop a comment. I really appreciate it. More to come. Talk to you guys later. Thanks again.